Alex. She volunteered to be our patient today for the head-to-toe assessment. Prior to beginning the exam, we took her height and her weight, gathered a full set of vitals. We checked her distant vision using the Snellen chart and her near vision using the Rosenbaum chart, observing her cranial nerve function. She emptied her bladder, she changed into comfortable clothes, and I washed my hands thoroughly, and we will now begin the assessment. We'll first start with the general inspection of her head and her face. The skin is uniform in color. The scalp is normal cephalic. I will then palpate the head, noting that it moves freely, there are no masses, lumps, or lesions, and the hair is distributed equally. I will then palpate the facial bones, noting for any pain or tenderness, and I will palpate the TMJ by having you open and close your mouth, noting for any popping or clicking or pain, and none is noted. I will then test your light sensation by having you close your eyes and tell me if you can feel this equally on your forehead,
Yes.
your cheeks,
Yes.
and your chin.
Yes.
Good. I will then have you clench your teeth, puff your cheeks, smile, stick out your tongue, clench your forehead, and squint your eyes, noting that these are symmetrical and even throughout, noting cranial nerve function. We will then assess the eyes, looking at the eyebrows, noting that they have equal hair distribution and they grow towards the outer canvas, looking at the eyelashes that grow outward. Then we will look at the sclera and the conjunctiva. The sclera is white and the conjunctiva is pink and moist. I'll then have you stare at a spot on the wall and have you cover one eye and uncover, then cover the other eye and uncover, noting for any nystagmus or extraocular movements. I'll then have you cover one of your eyes again, and I'll cover mine, and please tell me when you can see my fingers. Okay, now cover your other eye. Good. Checking her peripheral vision. We will then have you follow my pen light through the cardinal fields of gaze, keeping your head stationary. Noting that the eyes transition smoothly through the fields of gaze with no nystagmus or extraocular movements. We will then test your direct and consensual pupil reaction. Direct and consensual, direct and consensual, noting cranial nerve function. We will then move on to the ears, palpating the auricles, noting for any pain or tenderness. I will then look at the tympanic membrane, noting that it is pearly gray with no swelling, and that the ear canals are clean. We will then test her hearing, first with the Weber test. I'll strike the tuning fork and place it on the top of your head, and tell me if you can hear it equally.
Yes.
clavicular chain, the posterior clavicular chain, the deep cervical, the supraclavicular, the infraclavicular, and the axillary nodes, noting that there is no pain, tenderness, or swelling noted. We will then inspect the neck, noting that the color is uniform throughout. The trachea appears to be midline. We will then palpate the trachea, noting that it is midline. We will palpate the thyroid by having you swallow, noting that it transitions smoothly. I will then palpate the carotid pulses, one at a time, noting their rate, rhythm, and intensity, which are 2+ bilaterally. I will then check your range of motion by having you place your ear to your shoulder and your other side, chin to chest, and back to you. There we go. And then I will apply pressure, doing the same movements. And then I'll have you do the shoulder shrug, noting for cranial nerve function. I will then auscultate the carotid pulses with the bell of my stethoscope. I'll have you take a breath in and hold. Okay, breathe. Breath in and hold. Okay, breathe. And I'll listen to the thyroid. Good. No bruits are heard. We will then move on to the inspection of the chest. Looking at the color of the skin, which is uniform throughout, there are no obvious pulses or heaves or lifts. I will then palpate the chest wall, noting for any pain or tenderness. I will palpate the cordium, noting for any heaves or lifts. Then the left apical pulse, noting the rate, rhythm, and intensity of the heart. And then I will palpate for tactile primitus by having you say 99, 99, 99, 99, 99, 99, and 99, 99. Good vibration is heard throughout. I will then percuss the chest wall. Noting for resonant sounds heard throughout. Okay, I will then have you put your hands on top of your head. We'll check the lateral sides, comparing side to side. Good. I will then auscultate the lung sounds. Have you take a deep breath in. Comparing side to side in a symmetrical fashion. Okay, then I'll have you put your hands above your head again. We'll listen to the lateral side, comparing side to side. Good. We'll then listen to the heart, starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 are heard throughout and no murmurs are noted. I'll then have you turn around. We'll inspect the back. First, looking at the skin, noting that it is uniform in color throughout. We will then palpate, noting for any pain, tenderness, or lesions. I will then palpate for tactile primitus by having you say 99, 99, 99, 99, 99. Good vibration is heard throughout. We will then percuss. feel. We will then palpate the kidneys and the aorta. Good. And then I will have you lift your head slightly off the pillow, and we will palpate the abdominal muscles. Good. All right, you may now sit on the side of the bed for me. We'll look at the upper extremities, noting the skin color is uniform throughout, the temperature is warm, and there is equal hair distribution throughout. We will check the brachial pulses, noting their rate, rhythm, and intensity, which is 2+ bilateral, and the radial pulses, which is 2+ bilateral. We will look at the fingers, checking for capillary refill, noting that it is less than 3 seconds, and that there is no clubbing, and there is no edema noted. I'll then have you put your arms out like this, and push up, and push down, and put them in front of you, push up, and down. Good. We will then move on to the lower extremities, noting that the skin color is uniform throughout, the temperature is warm, and there is equal hair distribution. We will palpate the popliteal pulses, the tibial pulses, and the pedal pulses, noting their rate, rhythm, and intensity, which is 2+ bilateral. I'll then have you push up with your feet and push down. Good. I will then test your sharp and dull sensation. Please close your eyes and tell me what you can feel. Soft, sharp, soft, sharp, sharp, soft, sharp, soft, sharp, soft, sharp, soft. Good. I will then test your reflexes, your brachial, your radial, brachial, and radial, then your knee, and your Achilles. I will then have you stand up for me and turn around. We'll first just inspect the back, noting that the spine is midline and no obvious deviations. I will then palpate the cervical spine, the thoracic spine,